My name's Dr. Nick Carr. I'm a GP in St Kilda in Melbourne, Victoria. I was trained in the UK, came to Australia 32 years ago and have worked in general practice since I've been in Australia. So I got dragged kicking and screaming into the voluntary assisted dying world because I had a patient of mine called Beverly Broadbent who asked me to assist her with the end of her life. And it was her request to me and my involvement with her and her subsequent death that led me to be involved with the whole concept of voluntary assisted dying. Beverly was a wonderful woman who I'd known for many, many years. And in fact, somewhere around about, can't remember exactly, about 2005 was when it first happened. She came to me, she waved this bottle of old tablets at me and said, "I'd like some more of these." I said, "I've got no idea what they are because the label's been rubbed off." And she said, "Yes, I think they're a bit old now." And she told me they were barbiturates and that she'd acquired them many years previously. And they were her little thing that she kept because if she ever needed to take her own life, they were the thing that was going to do it, but she was worried they'd got too old and asked me to supply her with a fresh batch of barbiturates. And barbiturates are one of the few medications we still have that are in overdose pretty reliably fatal. And I said, "Well, slightly unusual request, Beverly." And I certainly couldn't tell you. I said, "I had no idea what dose you'd have to take." And she said, "Oh, don't you worry about that. You just give me the prescription. I'll do the homework." So I did. I gave her the prescription because she said, "I'm not planning to take them. I just need to have them if I ever want to use them." And so did that, forgot all about it. But she and I talked about her end of life preferences on and off over the years. And she got a bit older. She had a very, very close friend who was also a patient of mine who was furious because she had cardiac surgery when she didn't want cardiac surgery, which prolonged her life unnecessarily, and she was very cross about that. And she eventually died, and that was Beverly's best friend. And Beverly said to me, "Well, I am not risking what happened to Betty, so you have to promise me if I get sick like Betty did, that you will kill me." And I said, "Well, I can't actually do that, Beverly, because it's called murder, just kind of not okay." But I knew what she meant. What she meant was if I had a stroke or something, I'm incapacitated, I can't take my barbiturates. Do not let me linger on like that. And I said to her, I can't do that, I'm sorry. And she said, "Well, in that case, I will have to kill myself before I'm ready to go because I'm not prepared to risk becoming incapacitated." And we had this conversation on many occasions, and she got a bit older, she got a bit more frail, she developed breast cancer. I remember it well. She said, "Oh, I found this funny lump," and I had a look and I said, "Well, Beverly, you've got breast cancer." And she said, "Well, how bad is it?" And I said, "Well, it's a fairly early stage." She said, "Well, we're not going to do anything, are we?" I said, "Well, knowing you, no, we're not." Because she said, "Well, it's not going to kill me in the next 6 months, is it?" I said, "Oh, no way." She said, "Well, I'll be dead long before it causes trouble then." So we never even did a mammogram, anything. So it was just a clinical diagnosis. But that wasn't the reason she took her own life. The reason she took her own life was because she knew she was getting older, frailer. She didn't have much more to look forward to. And she made the decision at some point that she would finish when it suited her. And indeed, that's what she did. She came to see me on Friday and told me she would be dead on Monday. And so I would be getting a phone call. And so I got the phone call on Monday, and she had done exactly what she promised she would do. I had no doubt that Beverly was going to go ahead. She was an extraordinary woman. She was extremely determined. And to be really clear about it, there was no question, this woman was not depressed. This was not a psychiatric illness. This woman was of completely sound mind, just determined that she was not going to linger on. I said, "How do you know when to do this?" And she said, "Well, you know me and my friends, we love the theatre." And I was looking and I saw that there was this show on in Sydney. I thought, I'd love to see that show. And then I thought, I've seen enough shows. And that's how I knew. And I thought that was just lovely. She'd done what she needed to do. In this case, she'd seen the theatre she needed. She got her dog sorted out. She got a photograph album sorted out. She got her everything sorted out. And she was ready. Beautiful.